Gluten, a word often met with curiosity and apprehension, lies at the heart of numerous dietary discussions. This protein, primarily found in wheat, barley and rye, has become both a culinary staple and, for some, a source of significant health concerns. Join us as we unravel the enigma of gluten and its profound influence on our health. Gluten, a complex protein composite, forms when two smaller proteins, gliadin and glutenin, combine in the presence of water and agitation. This unique protein structure gives gluten its remarkable elasticity and viscosity, making it a prized ingredient in baking and food manufacturing. Imagine kneading dough. The more you work it, the more the gluten develops, creating those coveted chewy bread textures and airy pizza crusts. Beyond its starring role in bread, gluten finds its way into numerous processed foods, often acting as a binding agent, thickener or stabilizer. Think sauces, soups, and even some processed meats, where gluten might be lurking unexpectedly. Understanding the dual nature of gluten, its culinary versatility, and its potential to trigger adverse reactions is crucial for making informed dietary choices. Celiac disease, often mistaken for a mere food allergy, is in reality a serious autoimmune disorder. In individuals with this condition, the ingestion of gluten triggers a complex immune response that targets the small intestine, the body's primary site for nutrient absorption.
This immune system misfire leads to inflammation and damage to the villi, tiny finger-like projections that line the small intestine and are responsible for absorbing nutrients from food. As the villi become damaged, their ability to effectively absorb essential vitamins, minerals, and other nutrients becomes compromised, leading to a wide range of debilitating symptoms and long-term health consequences if left untreated. Some individuals may experience classic gastrointestinal symptoms like diarrhea, bloating, and abdominal pain, while others might present with less obvious signs such as fatigue, iron deficiency anemia, or even unexplained skin rashes. Recognizing the diverse manifestations of celiac disease is crucial for early diagnosis and intervention.
The path to diagnosing celiac disease can be a winding one, often fraught with uncertainty and frustration. This is largely due to the wide range of symptoms it can present, some of which mimic those of other common conditions, making accurate identification a challenge.
If you suspect you or a loved one might be struggling with celiac disease, seeking the guidance of a healthcare professional is paramount. They can help you navigate the diagnostic maze, starting with a thorough medical history review and a physical exam. Blood tests to detect specific antibodies associated with celiac disease are often the first line of investigation. However, a definitive diagnosis usually requires a biopsy of the small intestine, a procedure performed using an endoscope to obtain a small tissue sample for examination under a microscope. Early detection and treatment can significantly improve long-term outcomes and allow individuals with celiac disease to thrive.
While celiac disease represents a severe autoimmune response to gluten, there's another condition known as non-celiac gluten sensitivity, or NCGS. Individuals with NCGS experience symptoms like bloating, diarrhea, and fatigue, but without the intestinal damage seen in celiac disease.
The exact mechanisms of NCGS are still being researched, making it challenging to diagnose and manage. Some theories suggest reactions to other components of gluten-containing grains, or factors like gut microbiota imbalances. If you suspect NCGS, work with a healthcare professional to explore dietary modifications.
Navigating a gluten-free world requires vigilance and a keen understanding of where gluten lurks within the modern food landscape. While obvious culprits like bread, pasta, and cereals top the list, gluten often hides in plain sight, making its way into a surprising array of processed foods and condiments.
Wheat, barley, and rye, the trifecta of gluten-containing grains, form the foundation of countless food products. But gluten's reach extends far beyond these staple ingredients, finding its way into sauces, soups, salad dressings, and even some medications as a thickener, stabilizer, or flavor enhancer. Being a savvy label reader is paramount for anyone following a gluten-free diet. Scrutinizing ingredient lists for any mention of wheat, barley, rye, or their derivatives is crucial. Cross-contamination during food processing or preparation poses another significant risk for those with gluten sensitivities.
For individuals with celiac disease or gluten sensitivity, becoming a meticulous label detective is non-negotiable. Food labels are their primary shield against accidental gluten ingestion, requiring a discerning eye and a deep understanding of hidden sources and clever labeling tactics.
It's not just about scanning for the obvious wheat or barley, it's about recognizing gluten's many aliases and understanding how cross-contamination can occur. Look for products bearing a certified gluten-free label from reputable organizations like the Gluten-free Certification Organization or the Celiac Support Association, which conduct rigorous testing to ensure compliance with these standards. Ingredients lists can be tricky, employing seemingly innocuous terms that mask the presence of gluten. Be wary of ingredients like modified food starch, natural flavorings, or caramel color, which may be derived from gluten-containing grains. By arming yourself with the tools to decipher food labels effectively, you can confidently make informed choices that protect your health and well-being.
For those with celiac disease or gluten sensitivity, transitioning to a gluten-free lifestyle isn't just a dietary choice, it's a life-altering shift that paves the way for healing and improved well-being.
Eliminating gluten, the very trigger that sets off their immune system and leads to debilitating symptoms, allows the body to begin repairing the damage and restoring optimal function. The benefits of embracing a gluten-free diet extend far beyond symptom relief. Individuals often report increased energy levels, improved digestion, reduced brain fog, and even clearer skin once gluten is removed from their diets. A well-planned gluten-free diet should be rich in naturally gluten-free whole foods like fruits, vegetables, lean proteins, healthy fats, and gluten-free grains like rice, quinoa, and corn. With a plethora of gluten-free alternatives available and a world of culinary inspiration at your fingertips, embracing a gluten-free lifestyle can be a delicious and fulfilling journey toward improved health and vitality.
While adopting a gluten-free diet is essential for managing celiac disease and gluten sensitivity, it's crucial to approach this dietary shift with careful consideration to ensure nutritional adequacy.
Gluten-containing grains, while problematic for those with sensitivities, do contribute certain vitamins and minerals to the diet, and their removal requires mindful substitutions to prevent potential deficiencies. One common concern is the intake of B vitamins, particularly B vitamins like thiamine, riboflavin, and niacin, which are often added to fortified wheat flour. Individuals following a gluten-free diet should prioritize consuming naturally rich sources of these nutrients, such as legumes, nuts, seeds, leafy green vegetables, and lean meats. Iron deficiency is another potential concern, as iron is also commonly added to fortified wheat products. Prioritizing gluten-free whole grains like quinoa, brown rice, and amaranth, along with plenty of fruits, vegetables, legumes, and nuts, can help ensure adequate fiber intake.
Navigating a gluten-free lifestyle, especially in the beginning, might feel overwhelming, but with practical strategies and a positive mindset, it can become second nature.
Start by transforming your kitchen into a gluten-free haven. Clear out any gluten-containing products and invest in dedicated gluten-free cutting boards, toasters, and utensils to prevent cross-contamination. Grocery shopping requires a discerning eye. Familiarize yourself with gluten-free sections in supermarkets and explore health food stores offering a wider variety of gluten-free products. Dining out presents its own set of challenges, but with careful planning, it doesn't have to be a minefield. Call restaurants ahead of time to inquire about their gluten-free options and communicate your needs clearly to your server.
As we conclude our exploration of gluten, one resounding message emerges. Knowledge is power. Understanding gluten's role in our diet and recognizing gluten-related disorders are essential for empowering individuals to take control of their health. For those with celiac disease or gluten sensitivity, a gluten-free diet is a necessity, a lifeline that allows them to thrive. By avoiding gluten, they can heal their bodies and experience vitality. It's about fostering empathy, supporting those who live gluten-free, and promoting inclusivity in social gatherings. Let's champion gluten awareness, break down misconceptions, and create a world where everyone feels supported and empowered.